Mr. Graves and Ms. Banks will wrap us up today with something that we can take away. Thank you.
That's a tall order.
All right.
You're ready.
Okay. Good afternoon. My name is Scott Graves. I'm the Research Director for the California Budget and Policy Center. We're a nonpartisan research organization that focuses on state policies affecting low and middle-income Californians. I've been asked today to provide some testimony that sort of stitches together some of the statistics you've heard by other presenters throughout the afternoon, really in an effort to provide some key context and recent trends in the SSI-SSP program specifically, largely because the problems that have been created for Californians in the SSI-SSP program were created here in Sacramento by state policymakers. Often we can point the finger to Washington, D.C. and suggest that policies enacted at the federal level have caused problems for us out here in California. This is not a situation in which we can make that argument. To the extent that we have created problems for low-income seniors and people with disabilities in California who rely on this program. That is because of policies enacted here in the state capital. I believe you're maybe trying to call up. If you go to View, sorry, go to View, and you should be able to do full screen mode. Some of these technical difficulties. Do you see full screen mode? There we go. And
all right, thank you. Thanks.
Okay. So just quickly, not reading from slides or anything, I just want to make sure we're all on the same page in terms of this program and the value it has for low-income seniors in California. It does provide cash assistance for well over 1 million Californians to help them meet basic living expenses. You've heard that seniors and people with disabilities and SSI-SSP do not qualify for CalFresh, so dollars that they receive through SSI-SSP are helping them pay for food, are helping them, or at least intended to help them pay for California's relatively high housing costs. Grants are provided to both individuals as well as to couples, and the dollar amount depends on a range of factors, including whether an individual lives independently and has other sources of income. Funding is provided through both of the federal government and the state government. In the coming fiscal year, 2015-16, the federal government is expected to provide just under $7.5 billion in funding for SSI-SSP. The state is expected to provide just around $2.5 billion. So it's about a $10 billion program. So what do we know about SSI-SSP in terms of the impact of state cuts? It's that state policymakers here in California made deep reductions to SSI-SSP grants in order to help close budget shortfalls here in California that resulted from the Great Recession. At the time we made the cuts, there was some hope here in the capital and around California that those cuts would be temporary, and as the economy came back and things got a little better for the budget, that we'd sort of rebuild the program back to a base level we saw in 2008, 9, and before. That has not happened. The governor's proposal for 15-16 would pretty much leave in place the cuts that were enacted several years ago. What kind of cuts are we talking about? Things, for example, the legislature several times suspended cost of living adjustments. Finally, in 2010-11, that was the first year in which they ended the cost of living adjustment altogether, so that question no longer comes before the legislature. Should we provide a COLA? It's not required to be answered anymore because there is no state COLA for SSI-SSP grants any longer. The state legislature and the governor also cut the state's SSP portion of the grant down to the minimum levels allowed by federal law. That's $156 for an individual and somewhere in the range of $360 for a couple. As a result of these cuts, we see two different outcomes. For the state, if you simply as a policymaker want to put on your green eye shade and figure out, well, what does this mean in dollars and cents for the state budget? Well, I can show you that. What it means is when you adjust for inflation, the very far left bar on this chart, the state was spending just under $4 billion of its general fund revenues in 2007-8 on SSI SSP grants. That's the state's SSP portion. Today, we're spending $2.5 billion, and we would continue to spend $2.5 billion under the governor's proposed budget. That effectively means that we have taken $1.4 billion out of the state's contribution to SSI SSP in California. In other words, from the green eye shade perspective, the state budget is saving over $1 billion per year as a result of what appear to be ongoing and potentially permanent cuts to SSI SSP unless the legislature acts to change that. So the story is very different for individuals and how they were affected. The state saw dramatic savings, well over $1 billion. Individuals didn't fare quite as well. As you've heard many times today, the January 2009 level was sort of the peak for both individuals and couples in terms of the amount of SSI SSP cash assistance they received. Grants today remain below those January 2009 levels. So what this first chart shows you is grants for individuals. The maximum grants going back to January of 2009, the far left bar of the chart. The gold portion is the state's SSP contribution. The blue portion is the part that comes from the federal government. You can see over time the grant has been rising. The only reason it has been rising is because the federal government has been providing its cost of living adjustments for its SSI share. At the same time, as I mentioned, the state has not been providing any COLAs for SSI SSP grants. So as a result, even though the grant has been sort of ticking up year after year, it's still below the level we saw back in January of 2009 and would remain so through next year unless policy changes are made. The story is similar when you look at grants for couples. This is the same story going back to January of 2009. Grant levels are higher because couples in California receive higher grants. But back in January of 2009, again, that was the peak. Tremendous drop from one year to the next as a result of the state's cuts. Again, nothing the federal government did to us here in California. These are policy choices that were made here. There was some criticism of earlier in the hearing regarding the use of the federal poverty line as a measure, as a gauge of well-being. I fully understand that. It does have some value in terms of being able to compare across time, so we have used it here in the next couple of charts I'm going to show you. This is just to get a sense of the maximum grant for individuals. Again, we're going back this time to January of 2007. You know, SSI SSP grants didn't keep Californians in the program that far above the poverty line. They were sort of just above poverty if you received the maximum grant back in 2007, 2008, 2009. But as you can see, as a result of state cuts, starting in 2010, we see grant levels drop below that red line, which is the poverty line, and they remain there today around 90% of poverty. The story for couples is a little different. The grant for couples has never fallen below the official federal poverty line. It's come down from about 132% of poverty to about 112% of poverty today. But still, we see the trend is the same. Grants are falling relative to the poverty line. One other point I just wanted to make, I'm not going to dwell on it, it's been made very well earlier in the hearing, is just that because of state budget cuts, grants have been losing ground to housing costs. We all know that California is a high housing cost state. Some counties are cheaper to live in than others, but we put out a fact sheet last week that does compare the rent for a studio apartment in every county across California, and we did find that studio apartment rent exceeds half the SSI SSP grant in every county and exceeds the entire grant in 15 counties. In San Bernardino County, Madam Chair, the rent takes up about 90% of an SSI SSP grant. So give you a little specifics about the county you represent. So just quickly, I wanted to point out that there's some thinking that perhaps these cuts we saw in recent years were somehow unique. They're not unique. California policymakers have been looking to SSI, SSP for 2 to 3 decades when budget savings were needed as a result of economic downturns. We saw it in the 1990s. We saw it in the early 2000s as a result of the collapse of the internet bubble. If you go back to 1989-90, which is the start of this chart, if we had adjusted the grant for individuals for inflation every year going back to 1989, that maximum grant level would be $1,328 in the coming fiscal year. Instead, it's projected to be $900, and that's primarily because of suspensions of cost of living adjustments and cuts to grants that have been made, not just in recent years as a result of the Great Recession, but as I said, in prior years as well, due to significant downturns that California has faced. So the cuts were more severe in recent years, but they are really nothing new. They're not unique. What if you wanted to boost SSI, SSP grants? What would you have to do? At the most basic level, because a state budget, our state budget is a reflection of our state's values and priorities, you would have to change the state's current budget priorities. You would have to change the state's budget priorities. Why is that? Under the governor's proposal, the governor is projecting that we are going to see balanced budgets in California for the next several years. The governor's long-term forecast is projecting balanced budgets. Now, on the face of it, that's a good thing. You don't want to see the governor projecting deficits for years to come. But one way in which the governor assumes a balanced budget is that these cuts to SSI, SSP would remain in place going forward, would remain in effect for at least the next several years. And that allows the state to, quote, free up more than $1 billion in savings as a result of not reversing the cuts that were made in recent years. By not reversing the cuts, of course, you're jeopardizing the well-being of 1.3 million Californians. So the legislature, as always in any budget year, has choices. You can decide that you are going to prioritize this program and you're going to fight to restore everything in 1 year. You can argue that maybe we need a more measured approach and maybe we need to talk about how we plan to build back the program over a number of years. That would be another option. In any case, you really would have to talk about changing priorities, because if the priorities are not changed, the cuts remain in place. And Californians who rely on this program continue to suffer the consequences. So one way of looking at this is only one way, is what, and you heard some of this earlier in the hearing, is what would you have to do to get the state's grant for an individual up to just the poverty line? You're not raising them well above poverty. You're just trying to meet that very low bar. So here's the bar. The red line is the poverty line for an individual in 2015. Right now, the bar on the left shows you that our SSI, SSP grant for an individual falls below that line. It's $889 a month, of which $156 comes from the state. That's the gold portion. Because the grant fell as a result of state cuts, we can't ask the federal government to boost its share. So the state has to make up the difference. In order to do that, that would be roughly $91, $92 per person per month to increase, to get the grants just back up to the federal poverty line. Essentially, that means we've fallen in a hole that's about 100 feet deep, and we're trying to figure out how to crawl back out. In order to crawl back out of a hole that's 100 feet deep in this case, you need to boost the grant level, the SSP portion, by about $90 per month. So I'll go ahead and conclude my testimony there, and I'm happy to take any questions. Thank you.
Can we hold questions, and let's hear from Ms. Banks. Thank you. Ms. Banks.
Good afternoon, Madam Chair and Assemblywoman Lopez. My name is Cynthia Banks. I'm the Director of Los Angeles County Department of Community and Senior Services. This department administers a broad range of human services. Okay. Human services. It oversees a number of human services programs and workforce development. As part of this department, I oversee the second largest area agency on aging in the nation. However, we partner very closely with the City Department of Aging, which has the third largest area agency on aging, and together we are the largest AAA in the world. So I'm very proud to represent all of us here today. About 50 years ago, President Lyndon Johnson established initiatives known as the Great Society and the War on Poverty. Although great strides were made with major policy changes, including the Older Americans Act, we still face similar challenges today, and we have more work to overcome poverty among seniors. On the issue of measuring poverty, I want to mention the Elder Index, which you've heard about throughout the hearing today, that sheds new light on the real numbers of seniors in poverty. Using this index provides a more adequate measure of poverty and the level of financial resources needed to meet the basic needs of everyday living. It also shows a realistic impact on how many individuals fall within the poverty rate. As you heard from Gabriela Sandoval this afternoon, the Elder Index was enacted in 2011 through AB 138. The law requires the California Department of Aging and area agencies on aging to utilize the Elder Index as a reference when making decisions about allocating resources to specify the cost of meeting basic needs for elders when planning for our service areas. This is a unique tool that quantifies the costs that elders face in meeting their basic needs, including but not limited to food, shelter, health care, transportation, utilities, and essential household items. Using the Elder Index, an elderly renter living alone in Los Angeles County will need approximately $24,000 per year to adequately meet his or her basic needs, including the housing, food, out-of-pocket medical expenses, transportation, and other necessary spending. As you have heard today as well, what our seniors receive getting SSI falls greatly below that $24,000. So as a result, we have a number of seniors living in poverty. By using the federal poverty guideline levels, only 9% of our seniors fall below the poverty line. However, by contrast, if we use the Elder Index, 54% of our seniors would fall below the poverty guidelines, and that is significant. In January, my department convened 6 public hearings to discuss our area's plan for addressing resources. Our service providers were there, as well as our seniors. The majority of the public comment was summarized into 4 major areas: nutrition, transportation, housing, and employment. For nutrition, our congregate meal and home-delivered meal programs were identified as needing additional funding. We are finding that more and more seniors come to our centers, and we find more and more frail individuals being housebound and needing to have their meals delivered. We also know that as our baby boomers population grows, we are finding that more and more of them are coming to our community and senior centers within Los Angeles County. With regards to transportation, we have found that this is a major issue for us, as Los Angeles County is quite large, and the transportation system there does not allow for easy public transit. My department does not administer dial-a-ride. However, there is an access system which is operating within Los Angeles County. Many seniors indicate that they have problem getting from one city to another, as there are individual cities within Los Angeles County that operate senior programs, but they do not transport them, say, from Culver City to Los Angeles, because they operate within the city boundaries. It often takes, even with those systems, days to get a reservation. Many of those individuals who need emergent medical care cannot get to their doctors on time because you have to make an advance reservation, and those transportation opportunities are not there. We've heard as well at length about housing concerns. there is an insufficient supply of affordable housing for our seniors. And we know that because some of the housing programs require a percentage of your income to qualify, most of our seniors just do not qualify. Employment, as I indicated, is the fourth piece of the issues that we heard earlier today, that we heard from our seniors within Los Angeles County. This is an area where we know that many of our seniors would like to work, but do not have an opportunity to do so. Within the funding for the Older Americans Act, we have Title V, which is the Older Americans Act opportunities for work for those individuals who are 55 and older who fall below the level of poverty. Just because the basic minimum wage has increased, it has reduced the number of individuals we have been able to employ using this program. We saw that we had 175 slots initially available for fiscal year 2014 to 2015. That was reduced by 18 slots because the minimum wage went from $7.25 per hour to $9 an hour. We know that we have a number of seniors that would enjoy and would welcome an opportunity to work even more than the 175 slots that we have been offered, but the funding is just not there to allow us to work with those individuals, to place them in employment. I highlight these four service area needs in Los Angeles County to demonstrate the lack of resources among seniors to secure basic necessities of daily life. Food insecurity remains a top demand among our seniors. In fiscal year 13-14, we served approximately 2.8 million meals, 1.3 million of them being congregate and over 1 million being home-delivered meals. We know that our service providers are also doing overservice, providing meals for which we do not pay for through our Older American Act dollars because they know that the need is there. They go out on their own to find additional funding sources because they don't want to turn away our seniors. We also know, working with our senior Los Angeles County Department of Public and Social Services, that a number of seniors have now enrolled in the CalFresh program. As Rachel Calvarero stated earlier, housing and the lack of affordable housing is another critical issue facing seniors. Homelessness among seniors is becoming more and more prevalent. A 2008 report by Shelter Partnership made some startling findings in Los Angeles County. It found that on any given night, there are over 3,000 homeless older adults, 62 and older, in Los Angeles County. Over two-thirds of the homeless were male. 57% of the homeless adults are Black and Latino Hispanics, which represent 14 to 15% of the homeless population. 62% report they have had some form of disability while being homeless as well. At least one-third of the homeless older adults are chronically homeless. The homeless older population also suffers multiple health problems such as dental problems, eye problems, hypertension, and associated heart problems. Mental health problems such as depression are also common. Unless the housing situation is first stabilized, addressing the multitude of health issues affecting this population is very difficult for the service planners and providers. As poverty increases among seniors, the homelessness of the older adult population will likely increase as well. According to a USC study, during the second quarter of 2014, the average rent in Los Angeles County was $1,716. Most seniors on a fixed income cannot afford those costs. My department also oversees 14 community and senior centers throughout the county. We have identified trends for needs in these areas as well. We know that many of the seniors visit our senior centers on a regular basis. But what we have also found is during the holiday season, we find that more seniors visit. Many of our seniors have family coming in and work with them. However, they don't have the capacity to help them out. So you find them coming to our centers for meals as well. We also find that in the northern part of Los Angeles County, the Antelope Valley, there is a fast-growing demographic of seniors. It is very difficult to provide services because there are a lot of rural areas. There are not enough services and not enough nonprofits available in that area to serve the needs. So that particular center in the Antelope Valley is one of our most highly populated. In that center alone, we served over 4,000 clients for both our congregate and home-delivered meals. This year alone, I mean, that was 4,000 was for last year. This year alone, so far, we are at over 3,100. And so we know that that population is continuing to grow. We also know that our pantry services are growing. Most of my centers operate pantry services for families who are in need. In the Antelope Valley and throughout our centers, our pantry service is growing as well. I want to conclude my remarks by referring to a story by Steve Lopez in the Los Angeles Times, published on March 11th, 2015. It is about a shoe repairman living and doing business in Echo Park. The following are some key characteristics of this shoe repairman. He is an older Latino single adult male, age 71, separated from his spouse and living alone. Raised a family of 4 children along with his wife. Still, he has to work 7 days a week, 10 hours a day to make ends meet. Gentrification of his neighborhood has increased housing costs, so he is homeless. He uses his local McDonald's as a restroom for himself. He lives in one of his old vehicles, which is a 1995 GMC Safari. He has applied for low-income housing, but is most likely on a long waiting list. He has had a stroke, which occurred about 2 years ago, and can barely see out of one eye. The story presents a common profile of seniors living in poverty in Los Angeles County. These individuals are often not included in studies or reports or policy briefs that address the issue of how low-income and poor seniors struggle every day for the basics of life, for food, for transportation, access to health, medical care, and just dignity. Poverty among seniors is on the rise due to many factors such as those I have mentioned and those you have heard from other speakers today. We need to be able to provide adequate housing, adequate health and medical care, and income stability so that they can meet the basic needs of life. Another effect of senior poverty I want to mention lastly is isolation. As mentioned before, those transportation costs and the inadequate medical care many times makes our seniors isolated and make them feel that they cannot socialize with others. Lack of socialization can breed additional medical issues that we need to address as well. Having a clear picture of the extent of poverty among our seniors is as important as the legislature debates both policy and budget issues affecting all populations, essential especially for seniors. I hope that I have added to that picture. I applaud your foresight and leadership in convening this hearing. I'd like to end by saying that I would like to echo Myrtle Mills and Sandy Costa's comments today. And those words were, we need to listen to our seniors. Just listen. Thank you.